I am Dr. Kingsley R. Professor and orthopedic spine surgeon affiliated with the Herbert Wertheim College of Medicine at Florida International University. My co-authors and I thank JBJS for publishing our scientific article, Comparative in Vitro Analysis of Wear Particles Generated by a Viscoelastic Disc versus 2 Articulating Total Disc Replacements. We already knew from the joint arthroplasty literature that wear, debris, and osteolysis are major causes of failure. We are now seeing similar osteolysis with articulating spinal discs, yet no scientific study had measured and compared the wear particles produced by these devices. That gap in evidence is what led us to perform this research. Running 30 million cycles created practical challenges, maintaining consistent sampling and preventing contamination. We refined our filtration and handling methods to ensure accurate particle analysis. What stood out was particle size. The Charité and ProDisc articulating discs generate average submicron particles about 0.2 to 0.4 microns, which are the most associated with inflammation and osteolysis. The Axiomed viscoelastic disc particles average 1.9 microns, which are far less biologically reactive. These results should inform surgeons to consider wear characteristics when choosing an articulating disc replacement. The Axiomed viscoelastic disc does not behave the same as ProDisc in the size of the wear particles. Avoiding submicron debris may reduce long-term osteolysis. In vivo wear is the key unanswered question for Axiomed. After more than 10 years of clinical use, we still have not had a single Axiomed viscoelastic disc showing osteolysis. However, we will need an explanted device for retrieval analysis to confirm that the low Axiomed in vitro wear carries over into real-world performance. Thank you.